My name is Fred Trotter, and I am here at Datapalooza. I'm a healthcare data journalist, and this is the streaming booth. Really excited to have the data chief panel. And I think Dr. Mooney, is that the right way to pronounce your name?
Yes.
Is the earliest and also has the least time. So we are so thankful that you did make time for us. Really appreciate it.
Happy to be here.
So what brings you to Healthcare Datapalooza?
Sure. So I am the director of the Center for Information Technology at the National Institutes of Health. It's one of the 27 institutes and centers of the NIH. Very, very interested in data and the technology that helps drive data. So when I got the invite to participate in a data officer panel, I was very excited to participate in that because I think that we are continuing to collect massive amounts of biomedical research data. That data can be very siloed. We have a strategy that is, we really want to make that data more available, more shareable, more interoperable using data standards and enable the research that we do through that. So really excited to be here and to hear about what other parts of HHS are doing in terms of their strategy and how we might be able to learn from the other parts of our organization.
We have the other healthcare chief data officers, and we don't have them. Never mind. And so we're going to keep on with this interesting conversation. You have a huge pile of data. The work you do is so great over at NIH. Thank you. And what are potential and recent healthcare data policy changes that you're excited about? Does interoperability changes impact?
Yeah. So there's been, over the last couple of decades, there's been increasing interest in the use of what we call real world data. That is clinical data that was, developed for the purpose of the clinic, of clinical care and other uses. If you think about it, historically research data has been a part of, clinical research studies or laboratory experiments, things like that, data that's produced for the purposes of research. But now we live in a world where we're able to use data for research that wasn't actually collected for research. So the use of standards becomes incredibly important for doing comparative effectiveness research across sites, for aggregating data, for the purposes of doing analysis everywhere from public health all the way through to biomedical research and just particular diseases, thinking about what we like to call the digital biomarker, that is, the bits that can, mark or be associated with a particular disease or an outcome from a treatment, things like that. So I think standards are really, really, really important. And applaud the efforts that, for example, HHS has done and the community that's here at Datapalooza have done to help champion the development of those standards, things like FHIR, and other, FHIR for the collection of electronic health record data and other, data standards to enable the kinds of research that we do, because I think that the more higher quality data that we have, the more data that's standardized enables its integration better, but also gives us a pathway to collect new types of data that we may not have been collecting before in the context of healthcare that will also improve our ability to, do research.
So it's hard to underestimate the, magnitude of someone coming from the NIH and talking about real world data. There's absolutely been this division historically and between kind of research data and the, kind of holy golden standard of the randomized, controlled double-blinded clinical trial versus the real world day-to-day treating of patients, and the fact that our research is becoming much more sophisticated now. It's really heartening to hear you say that. That's amazing. Do you want to talk about anything else from your session, or
I think if anything I would mention is I'd mention the importance of AI, responsible use of artificial intelligence. I think that's a game changer. I think we're in a period of disequilibrium. That is, AI is moving incredibly quickly. It's moving faster than I think research can keep up with it. And I think it has a big impact on data, how we use data, and also pressures, I think, to create high quality data so that AI is, unbiased, it's accurate. And I think we need to understand the use of AI in practice better. We're starting to see much more operational AI than we've ever seen in the past, which is, AI that's treated like an IT system that's actually implemented, put it in place, and then used. I think there's lots of opportunities for the study of the impact and downstream effects of AI, so that we can understand, understand how it can impact, the biomedical research world.
Yeah, the way I've been saying it to people who ask my opinion on this is the right strategy here is to try to skate to where the puck is going. It's awfully hard to do that if the puck is moving 1,000 miles an hour. And it does feel like that a lot of the times with AI.
I think that really emphasizes how important it is that we ask the right questions. I think, asking generalizable questions that are going to be the least affected by the technology and how that technology moves. But there's no doubt about it. Right now, AI is moving very fast, and it's very hard to keep up with.
That's a great place to leave the session. Thank you so much for making time. We really appreciate it.
Thank you so much.